NHA CCMA exam sample questions. Question 1. A patient performs a clean catch midstream urine specimen collection. What is the purpose of instructing the patient to void a small amount into the toilet first? Option A. To clear the urethra of external skin flora and contaminants. Option B. To reduce the total volume of the urine specimen. Option C. To test the flow rate of the urinary bladder. Option D. To ensure that the urine collected is from the kidneys only. The correct answer is option A. To clear the urethra of external skin flora and contaminants. The initial stream of urine flushes external urethral meatal flora and contaminants from the distal urethra. The midstream portion that follows is less likely to be contaminated, providing a more accurate culture result. Volume reduction is not a clinical goal. Question 2. A medical assistant releases a patient's lab results to the patient's spouse without written authorization. This is a violation of which federal law? Option A. OSHA. Option B. HIPAA. Option C. Affordable Care Act. Option D. Controlled Substances Act. The correct answer is option B. HIPAA. HIPAA, Health Insurance Portability and Accountability Act, prohibits the disclosure of protected health information, FI, to any party, including family members, without the patient's written authorization or a legally recognized exception. This applies regardless of marital relationship. Question 3. A medical assistant performs a urine chemical screening using a reagent strip. Which of the following parameters, if positive, indicates a probable urinary tract infection? Option A. Ketones and glucose. Option B. leukocyte esterase and nitrites. Option C. bilirubin and urobilinogen. Option D. Specific gravity and pH. The correct answer is option B. Leukocyte esterase and nitrites. Leukocyte esterase indicates the presence of white blood cells, pyuria, and nitrites are produced when bacteria convert urinary nitrates, both strongly suggesting a UTI. Ketones indicate fat metabolism or fasting, and glucose suggests hyperglycemia, not infection. Question 4. Which of the following cleaning methods kills all pathogenic microorganisms, including bacterial spores? Option A. Sanitization. Option B. Disinfection. Option C. Sterilization. Option D. Ultrasonic cleaning. The correct answer is option C. Sterilization. Sterilization is the only method that destroys all forms of microbial life, including highly resistant bacterial endospores. Disinfection eliminates most pathogens but not spores. Sanitization reduces microbial counts to safe levels but does not kill all pathogens. Question 5. Which of the following represents an example of positive, therapeutic nonverbal communication? Option A. Crossing arms tightly over the chest while listening. Option B. Maintaining appropriate eye contact and nodding in agreement. Option C. Looking at the clock or checking a smartphone frequently. Option D. Turning your back to the patient while they ask a question. The correct answer is option B. Maintaining appropriate eye contact and nodding in agreement. Maintaining eye contact and affirming nods convey attentiveness, respect, and empathy. Crossed arms signal defensiveness or discomfort, and checking a clock communicates disinterest. Nonverbal cues often carry more impact than verbal messages in clinical communication. Question 6. A medical assistant is preparing to assist with a punch biopsy of a skin lesion. Which of the following instruments should be included on the sterile tray? Option A. Tenoculum forceps. Option B. Biopsy punch and iris scissors. Option C. Speculum and obturator. Option D. Curette and uterine sound. The correct answer is option B. Biopsy punch and iris scissors. A punch biopsy tray includes the cylindrical biopsy punch tool, iris scissors to cut the base of the core sample, forceps, a specimen container, and local anesthetic supplies. Tenoculum and uterine sounds are gynecological instruments used for intrauterine procedures. Question 7. What is the primary cause of hemolysis in a blood specimen during collection? Option A. Inverting a tube gently 5 to 8 times. Option B. Using a needle gauge that is too small, such as a 25G needle. Option C. Releasing the tourniquet as soon as blood flow is established. Option D. Allowing the alcohol site to air dry completely before puncture. The correct answer is option B. Using a needle gauge that is too small, such as a 25G needle. Using a needle gauge that is too small forces red blood cells through an extremely narrow lumen under pressure, causing mechanical destruction, hemolysis. Other common causes include vigorous mixing, drawing through in 4-line, and not allowing the site to fully dry after alcohol cleansing. Question 8. Which type of advance directive designates a specific person to make medical decisions on behalf of a patient if the patient becomes unable to do so themselves? Option A. Living will. Option B. Durable power of attorney for healthcare proxy. Option C. DNR, do not resuscitate, order. Option D. Uniform Anatomical Gift Act declaration. The correct answer is option B. Durable power of attorney for healthcare proxy. A durable power of attorney for healthcare, also called a healthcare proxy, designates a named individual to make medical decisions when a patient lacks decision-making capacity. A living will specifies treatment preferences but does not designate a decision maker. Question 9. A medical assistant is reviewing a patient's history who works in coal mining and has been exposed to industrial dust. The assistant should recognize the risk for which disease? Option A. Emphysema. Option B. Asthma. Option C. Atelectasis. Option D. Pulmonary embolism. The correct answer is option A. Emphysema. Prolonged coal dust inhalation causes coal workers pneumoconiosis, black lung disease, a form of occupational lung disease leading to progressive massive fibrosis and emphysema. Asthma involves reversible airway obstruction and is typically triggered by allergens or irritants rather than industrial dust. Question 10. When performing a capillary puncture on an adult patient, which site is choice for the procedure? Option A. The lateral aspect of the heel. Option B. The distal pad of the middle or ring finger. Option C. The tip of the index finger. Option D. The fleshy lobe of the ear. The correct answer is option B. The distal pad of the middle or ring finger. The lateral or medial pads of the middle or ring finger are the standard sites for adult capillary puncture because they have adequate tissue depth and good capillary blood flow. The fingertip is avoided due to greater nerve density and pain. The heel is reserved for neonates. Question 11. When a patient uses an adaptive mechanism of projecting their own unacceptable feelings onto another person, which defense mechanism is being demonstrated? Option A. Sublimation. Option B. Projection. Option C. Displacement. Option D. Rationalization. The correct answer is option B. Projection. Projection involves attributing one's own unacceptable thoughts or feelings to someone else. Displacement redirects emotion toward a substitute target, while sublimation channels unacceptable impulses into socially acceptable behaviors. Question 12. A medical assistant is cleaning up a small blood spill on a laboratory counter. Which disinfectant solution is recommended by OSHA? Option A. 70% isopropyl alcohol. Option B. 110 dilution of sodium hypochlorite, household bleach. Option C. chlorhexidine gluconate. Option D. hydrogen peroxide 3%. The correct answer is option B. 110 dilution of sodium hypochlorite, household bleach. OSHA recommends a 110 dilution of sodium hypochlorite, bleach, as the standard disinfectant for blood spills because it is effective against blood-borne pathogens including HIV and hepatitis B. Isopropyl alcohol evaporates quickly and may not maintain contact long enough for full disinfection. Question 13. A patient with a new diagnosis of type 2 diabetes mellitus tells the medical assistant, "I don't think I can afford my insulin or test strips." To which resource should the assistant refer the patient? Option A. The state's public health department. Option B. A medical social worker or patient navigator. Option C. The local emergency department. Option D. The pharmaceutical manufacturing board. The correct answer is option B. A medical social worker or patient navigator. A medical social worker or patient navigator is trained to identify financial assistance programs, pharmaceutical patient assistance programs, and community resources for patients with medication affordability challenges. The emergency department is not appropriate for financial counseling. Question 14. Which legal doctrine states that an employer or physician is liable for the negligent actions of their employees performing duties within their scope of work? Option A. Residential ipsa loquitur. Option B. Subpoena duces tecum. Option C. Respondeat superior. Option D. Quid pro quo. The correct answer is option C. Respondeat superior. Respondeat superior, Latin for let the master answer, holds employers legally responsible for torts committed by employees acting within the scope of their employment. This doctrine reinforces the importance of proper training, supervision, and defined scope of practice. Question 15. What is the preferred injection site for an intramuscular injection administered to an infant? Option A. Deltoid muscle. Option B. Dorsogluteal muscle. Option C. Vastus lateralis muscle. Option D. Ventrogluteal muscle. The correct answer is option C. Vastus lateralis muscle. The vastus lateralis, located on the anterolateral thigh, is the preferred IM injection site for infants and toddlers because it is well developed and free of major nerves and vessels. The deltoid is used in older children and adults. The dorsogluteal site is avoided in infants due to proximity of the sciatic nerve. Question 16. When answering an incoming telephone call at a medical office, which of the following greetings is most professional? Option A. Hello, please hold. Option B. Good morning, Northside Clinic, this is Alex. How may I help you? Option C. Doctor's office, who is calling? Option D. Yeah, this is the clinic, can you wait a minute? The correct answer is option B. Good morning, Northside Clinic, this is Alex. How may I help you? A professional telephone greeting includes a salutation, the office name, the staff member's name, and an offer to assist. This establishes credibility and creates a positive first impression. Placing a caller on hold before identifying the office is rude and unprofessional. Question 17. What is the fundamental functional unit of the nervous system responsible for transmitting electrical impulses? Option A. Nephron. Option B. Alveolus. Option C. Neuron. Option D. Osteon. The correct answer is option C. Neuron. The neuron is the structural and functional unit of the nervous system, transmitting electrochemical signals throughout the body. The nephron is the functional unit of the kidney, and the alveolus is the gas exchange unit of the lung. Question 18. A medical assistant is taking an oral temperature using an electronic thermometer. Where should the probe be placed in the patient's mouth? Option A. On top of the tongue near the front teeth. Option B. Under the tongue in the posterior sublingual pocket. Option C. Along the side of the cheek opposite the molars. Option D. Directly underneath the frenulum near the front gum line. The correct answer is option B. Under the tongue in the posterior sublingual pocket. The posterior sublingual pocket, located at the base of the tongue near the frenulum at the back, is richly supplied by the lingual artery and provides the most accurate oral temperature reading. Placement near the front of the mouth is exposed to ambient air and yields inaccurate results. Question 19. When archiving or purging paper medical records, what determines the length of time records must be legally retained? Option A. The clinic owner's personal preference. Option B. State and federal laws regarding retention periods. Option C. The storage capacity of the medical facility. Option D. The alphabetization style used in the office. The correct answer is option B. State and federal laws regarding retention periods. Medical record retention is governed by state and federal statutes, which vary by record type and patient age. Adult records are typically retained 7 to 10 years, minor records must often be kept until the patient reaches adulthood plus an additional period. Deviating from legal requirements can expose the practice to liability. Question 20. A medical assistant is performing ear irrigation to remove impacted cerumen. Where should the stream of warm solution be directed? Option A. Directly at the center of the tympanic membrane. Option B. Toward the top or side of the ear canal wall. Option C. Toward the floor of the external auditory meatus. Option D. At the opening of the eustachian tube. The correct answer is option B. Toward the top or side of the ear canal wall. The solution should be directed toward the upper or posterior wall of the ear canal, not directly at the tympanic membrane, to allow it to flow behind the cerumen and flush it outward. Direct pressure on the tympanic membrane can cause pain or perforation.